As a nursing assistant, there are many things you can do to prevent the people in your care from being accidentally injured. Let's take a closer look at some common accidents that might occur. Falls happen to all human beings. As people age, factors such as declining eyesight or certain disorders such as Parkinson's disease or obesity, being overweight, can contribute to difficulties with movement and can also negatively affect balance. Medications can also increase a person's risk for falling. Falls can be serious, even fatal, and because falls can have such serious consequences, prevention is the key. Preventing falls begins with assessing the person's risk for falling. The nurse is responsible for assessing the person to evaluate the person's risk for falling when the person is admitted to the facility and periodically thereafter. Strategies for addressing and minimizing the risk factors are written into a person's care plan. And if the person is at high risk for falling, a symbol such as a falling leaf or a falling star may be placed next to the person's room number or above the bed to alert all staff that this person is at risk for falling. Here are some general actions that you can take to help prevent falls. Keep doorways, floors, and stairs free of clutter and tripping hazards, such as lamp cords and throw rugs. Wipe up spills on the floor immediately and use wet floor signs appropriately to alert others of any wet floor hazard. Ensure adequate lighting. Unless a person objects, make sure a nightlight is on at bedtime. If a nightlight causes confusing shadows, provide bright but indirect light. Encourage the person to use handrails along hallways and staircases and grab bars in the bathroom to support when walking, using the toilet, or getting into the bathtub or shower, and check that these devices to make sure they are tightly fastened to the wall. If a person wears eyeglasses, make sure they're clean and that the person wears them when moving around. If a person uses hearing aids, make sure the person is using them and they're turned on when moving around. Take time to orient the person to their surroundings. This is especially important when the person is confused or new to a facility or has poor eyesight. And make sure when the person is in bed, make sure the bed's lowered to the lowest position before leaving the bedside and assure that the wheels are locked. Keep the side rails lowered or raised according to the person's care plan. And be sure that the person's method of calling for help is within easy reach and answer those calls for help promptly. If a person must wait too long for help, the person may try to get up and solve the problem, risking a fall. If a person uses a cane or walker, inspect the device from time to time. Make sure the rubber tips have not become worn. And make sure that the person's cane or walker is within easy reach, so that person does not have to lean too forward or walk unassisted to obtain the device. Before helping a person into or out of a wheelchair, lock those brakes and make sure the wheelchair is secure. Make sure the person's clothing and shoes fit properly and are not tripping hazards. Frequently or hourly checks is really important. Check for pain, continence, positioning needs, and other issues that can help prevent falls. This is especially important for patients with dementia and cognitive issues. Those with dementia or cognitive impairments may not be able to ask for what they want or what they really need, and they will attempt to get up themselves unassisted to take care of those things themselves. As you go about your daily routine, you will use many pieces of electrical equipment, from grooming appliances, hair dryers, curling irons, electrical shavers, to furniture, adjustable beds, and lamps. Always inspect these electrical devices before you use them to make sure they're in good working order, and make sure cords are intact. A piece of equipment that is not working properly or has frayed cords can give a person an electrical shock. And shocks can also occur at electrical outlets. Use care when inserting and removing plugs, and advise those in your care to do the same. Use plastic outlet covers to prevent children or confused adults from sticking their fingers or other objects into the outlet. A poison is really any substance that causes injury, illness, or death if it enters the body. Cleaning supplies, fluids used for cars and home maintenance, and certain plants can all cause poisoning. Poisoning can also occur if a person takes the wrong medication or too much medication. To reduce the risks for accidental poisoning, make sure all containers are clearly and accurately labeled. Store all medicines, cleaning materials, and other potentially poisonous substances in locked cabinets and closets. A person can easily be burned if the water used for bathing is too hot. Turn hot water on last and off first, and check the temperature of the water coming out of the faucets. You can test the temperature of the water using your wrist, but remember that a person with decreased sensation may not be able to tell if the water coming out of the faucet is too hot. Teach people with decreased sensation to use a thermometer to measure the temperature of water before getting into a bathtub or shower, and that temperature of hot tap water should be less than 105 degrees. Foods or beverages that are too hot can also cause burns. If food is steaming or a plate is too hot to touch, wait until the food stops steaming or the plate has cooled a little before serving the meal. And also be sure hot beverages have cooled a bit before serving them. If a person has trouble keeping a firm grip on the cup, spills can occur, leading to burns. Serving a beverage in a cup with handles and a lid can help the person hold the cup more securely. Let's have a word about restraint. A restraint is any device that inhibits a person's freedom of movement. Restraints can be physical or chemical, and a physical restraint is attached to a person's body to limit their freedom from movement or their ability to reach a certain part of their body. Examples of physical restraints include wrist restraints, mitt restraints, jacket restraints, vest restraints. Devices such as side rails, lap trays, and wheelchair brakes can also be considered and are considered physical restraints if the person is not able to move them independently. Chemical restraints are medications used to subdue a person so that that person is unable to function normally. So be aware of some complications associated with restraints. Strangulation, cutting off the air supply, can occur with some types of restraints like these vest restraints or seat belts if they're not applied properly, or if the resident or restraint moves and gets the device tangled around a person's neck. Entrapment and other serious injuries can occur. A person who struggles to get free from a restraint is at risk for serious injuries such as suffocation and broken bones. For example, a person who tries to climb over side rails may become caught in the side rails, which is entrapment. A person who is restrained may become more agitated and confused. A restraint that is applied too tightly can cut off the blood supply to the body part beyond the restraint, leading to tissue and nerve damage. If the person is not offered the opportunity to use the bathroom frequently enough, the person may become incontinent of urine, feces, or both. And finally, not being able to move freely puts the person at risk for pressure injuries, contractures, blood clots, pneumonia, incontinence, constipation, and loss of muscle tone and balance. It's important to know the rules and the conditions that must be met before a restraint can be applied. First, have all other alternatives to physical and chemical restraints been tried and proven unsuccessful? The person's response to these alternatives must be documented before resorting to the use of a physical or chemical restraint. A physician or a primary caregiver must see the patient face to face and must write the order for the restraint. The order must specify the type of restraint, the purpose of restraint, and how long the restraint is to be used. And there must be a clear medical reason for this restraint. A restraint is never to be used for staff convenience or to discipline a person. And finally, the person must be given an explanation of how the restraint works, why it's needed, and how long it will be used. Family members must also be given this information if the person wants them to have it, or if the person is not able to make decisions about their care independently. So let's talk about how to care for a patient who is restrained. It's so important to check on the person very frequently. The person may need to be reassured that the person has not been abandoned. Release the restraints at least every 2 hours and help the person go to the bathroom and stretch and change positions and do range of motion exercises. Inspect the person's skin for reddened areas and report any concerns to the nurse. Offer the person a snack or drink. Release the restraints more often if the person seems to be anxious or needs to go to the bathroom or is in distress. Observe the person carefully and report any changes in behavior, such as increased agitation, drowsiness, or decreased appetite, and immediately report that to the nurse. Report and record the care you provide and all of the observations you make. Stay tuned. Thanks for listening.